Okay, Mrs. Smith, we are here today to do a urinary catheter on you. The doctor's ordered it because you are not voiding properly. You're not expressing enough urine. So, if you could please tell me your name and date of birth. Julian Smith, great. And says in your ID band here, I've got that matching date of birth, 1/1/47, great. Gonna just verify that we have the same patient in the medical record here, and we do. Julian Smith, 1/1/47. First thing I want to ask you real quick is, do you have any allergies to any medications or any latex or iodine or any type of substances? No allergies at all. That's excellent, great. We're going to go ahead and close the door, and we're also going to close this curtain just in case anybody walks in, doesn't knock. I also have my charge nurse here who's female. Thought you might feel a little more comfortable with that if you're okay with her watching the procedure too. So what we're going to do is we're going to get you cleaned up here a little bit, and then we're going to use a urinary catheter. It's less than the size of a straw. We're going to put that directly into your urethra after we lube it up a little bit, and then as soon as we get into the bladder area there, it should start expressing some urine out. Shouldn't be uncomfortable. If you do feel any pain, please let me know right away. So I'm going to go ahead and put some clean gloves on here and get you cleaned up. If you could, actually before we put the clean gloves on, grab another set of gloves here. I'm going to go ahead and perform hand hygiene. I think we already did, but can't hurt to do it again. Helps to have your hands a little dry when you put these gloves on. So these are not sterile gloves. We'll put those on here in a minute after we get you cleaned up a little bit. If you could go ahead and scoot your butt down just a little bit. If you need any help, I can help you. Need you to put your knees up and spread your legs. So we're going to go ahead and wipe you down. These are warm wipes. Tell me if they're too hot or too cold, okay? And wipe on this side first. Clean you up. Grab another wipe here. Wipe on this side. One wipe per side. We're going to go ahead and wipe down the front. Always going front to back on females. And one more wipe down the front. So, and we're going to go ahead and remove our gloves. We're going to perform hand hygiene one more time. Actually, I'm going to pull it out of this plastic package before we do that. And we're going to perform hand hygiene. Check the expiration date on the package, 8/31/24, which is good. Now we're going to perform hand hygiene. I'm going to remove the sterile gloves. Touching the outside of the package still and just the edges here. All right. I'm going to go ahead and put the glove on my dominant hand first, grabbing the inside of the cuff, the cuffed part here, and go ahead and slide that onto my hand. Now this hand is sterile, so I'm going to grab the inside of the cuff on this side. Okay, inside of this package is sterile, so I can grab it with my sterile gloves. Get that out of the way. I'm going to take the drape and move this back just a little bit for now. Take the drape and ask the patient to lift her bottom. Drape pad, whatever you want to call it. Since we have a box and not a patient, we're going to go ahead and lift it up for her. I know this hand is sterile, but patient did it themselves. So pad is in place. This package was closed. We just opened it to practice earlier and make some bad video, so sorry. So we're going to go ahead and remove one of the cleaning swabs. We're going to wipe down the my right side, her left side first, just one per swab. And then we're going to take the second swab and wipe on the left side, her right side. And then we're going to go straight down the middle, again, front to back on females. We're going to get rid of that packaging. We're going to take some lube, put it into the tray here. And then we're going to set that aside. We're going to lube the first 2 centimeters of the catheter in the tray here. And we're going to position this tray so it's a little bit closer. All right, ma'am, if you feel any pain, please let me know. You might feel a little pressure, and if I do meet any resistance, I'm going to ask her to breathe out. If there's too much resistance, I'm going to stop. So I'm going to spread her labia with my non-dominant hand and go ahead and insert the catheter into the meatus until we start getting urine out. I'm going to hold it with my non-dominant hand, making sure it stays in the tray here. We have urine coming out. Wait for the urine to quit flowing, 5 minutes or so, 10 minutes tops. I'm not going to sit here and do the 5 minutes. I'm going to tell the patient I'm going to go ahead and slide the catheter out now that we're done with the urine. Again, there shouldn't be any pain. I'm going to set this tray aside so that I don't spill it. We have to measure the contents there. I'm going to take the drape or the pad, go ahead and wipe her off, make sure there's no residual betadine. We could use some wipes if we have to clean her up. And we're going to go ahead and make sure she's covered. Remove our sterile gloves. Perform hand hygiene one more time. And we're going to go ahead and document the procedure.